Hi there, my name is Kathleen. I'm a registered psychologist, and on my YouTube channel I like to make videos that help provisional psychologists as well as psychology students. I also like to make content that centers around things like study, health, and psychology, so if any of that interests you, then please be sure to check out my YouTube channel. Back in November 2023, I undertook the National Psychology exam. I did all of my own study and preparation for it, and I passed on the first go. So I wanted to create this mini-series helping provisional psychologists who also have to take this exam. In this video, we'll be doing a deep dive into the assessment section and working out how you can form your own effective study strategy. I also need to make it really clear that none of the content in this video ruins the integrity of the exam. We are simply unpacking the NPE curriculum to work out a study approach, and we'll also look at some NPE practice exam questions which I have developed myself through all of the study that I've done. So hopefully this video is going to act as like a bit of a springboard to help you work out how to get started with the study and how to go about doing your own research and go about learning for it so that when you get to doing the exam you can feel a bit more confident. A lot of time, effort, and money has been put into creating this video series, so if you do find it helpful, some simple ways that you could show your support are by giving this video a like, leaving a comment, also watching it to the very end so that it boosts it out into the internet. Something you might want to consider doing as well, especially if you found this video helpful, is clicking on the 3 dots down below. There should be a little heart that says thanks, and just making a small donation. I would really appreciate this, and it would help make this work more sustainable. A final thing, I am currently growing on TikTok and Instagram, just sharing like my daily routines and what it's like working as a psychologist. I also share things like book recommendations and podcasts I'm listening to. So if you'd find any of that interesting, then please come and check me out on those spaces as well. That would really mean a lot. With the intro out of the way, let's just get into this video now. So I want to start off by saying that I found the assessment section the hardest part to study for out of the whole NPE curriculum because it's the largest, like there is the most information in it to learn, and also a big chunk of it required an element of memorization for assessment tools and mental health disorders. If we just quickly eyeball the curriculum, you can see that the assessment section takes up nearly 3 pages, and basically it outlines 5 parts that you need to cover. However, I bundled this into 3 when I was studying for it, so I'm just going to quickly explain this. Number 1 and 3 relate to each other because 3 is broadly talking about test selection, use interpretation, issues that you consider when choosing a tool to use. And then 3 is covering the tools themselves that you could select, that the exam basically wants you to know about. And then number 2, knowledge and understanding of forms of assessments. And 4, which is basically knowledge and application of interview assessments. So broadly speaking, 2 and 4 are assessment types. And then finally, number 5, that is basically knowledge of the DSM-5, definitions, diagnostic criteria, and essential features. Basically a list of disorders for you to study. So this video will be done in 3 parts. We'll be looking at how I formed a study approach for each part, how I went about preparing for it, and then we'll look at an exam practice question. The main resources that I'd recommend having for this part of your study is obviously the NPE textbook by Pelling and Burton. I'd also recommend having a copy of the DSM-5 TR, and if you can, the DSM-5 Made Easy by James Morrison. Those are the main resources that will help get you started. There's some other resources too, and I'll point them out as we go through this video. Okay, so if we look at part 1 of the assessment part in the curriculum, basically it's outlining things that you should consider when you're choosing a specific test. When I was trying to work out how to study this first part, I felt a little bit confused, like I didn't really know where to begin. So I always find it helpful when you're feeling a little bit unsure to go straight to the NPE textbook and just see what they say. Because for the most part, the NPE textbook follows the structure of the NPE curriculum. So I started off there to kind of work out what I should try and learn for point number 1. You'll notice they've got a heading, test selection, use and interpretation, and it's not a very long paragraph. So I just took a few notes from this paragraph that I felt were important, like the difference between random selection and random assignment. What I think this first point is really trying to emphasize is things to consider when you're picking out what assessment tool to use. And it kind of makes more sense when you go down to number 3 and the NPE asks you to study all of these different types of assessment tools. You can see that in point number 3, it outlines there are 6 main tests that you have to have a good sense of, and then you need to have a general sense of a range of other different types of tests. So when it came to learning these tests, specifically the main 6, I took into account points from number 1 and 3. So things like the application or the limitations of a test, its cultural responsiveness. I made sure that I could work out how to administer, score, and interpret the results. I just developed a short list of things that I felt were important to look out for, basically. Let's go over a quick example so that I can show you how I filled out this list in my study planner. I'm going to pull up the DAS, the Depression, Anxiety, and Stress Scale. DAS 21, DAS 22. Basically, I took all my notes mainly from the NPE textbook. I knew the DAS pretty well. I used this tool a lot for work, so I had a pretty good understanding of it. But yeah, I used the NPE textbook to take my notes. I kept it pretty brief, so with things like application, negative emotional states of depression, anxiety, stress. That's what it is measuring. It can be used to assess outcomes and monitor progress of interventions through pre and post scores. So it's a great tool to maybe use at the beginning of an intervention and then after. And then the limitations, it can only be used on adults. There's some validity that it can be used on adolescent populations, but care should be used when interpreting that data. It's not a diagnostic tool and it cannot replace clinical interview. It does not assess suicidality or risk. Norms, the DAS does have Australian norms, however, it hasn't been validated for Indigenous Australians or Torres Strait Islanders, so you want to have caution when interpreting results for these populations. We know that it has high reliability and validity. And then finally, scoring. I do want to actually quickly point something out for this. I only memorized the cutoffs for the severe or the extremely severe sort of ranges for the DAS and other tools like the K10. This is because I just think it's too much for people to know all the scores for all the assessment tools. I just think that is way too much to learn. Just having a rough idea of the more extreme scores, like I knew that for depression, if someone scored 14 plus, that was in the extremely severe range. That would be cause for concern. I felt like that would be enough to get me through the exam. I took a bit of a gamble with this. I really didn't know. That was just how I decided to go about learning and how much I felt like I could learn and know really well. And obviously for the DAS 42, you multiply it by 2. I applied this level of detail, not just for the DAS, but for all the 6 main psychometric tests that the exam asks you to prepare for. And then for the other tests, I didn't go into as much detail. I just tried to have like a general understanding of what they were testing and maybe some limitations that came along with them. If we have a quick look at an example from the general tests, let's say like the PHQ-9. So generally, I knew that this was used to diagnose depression and monitor the severity of depression. And limitations, like it had no Australian norms. Sometimes I'd sort of try and know the scoring a little bit too, if you want to be really thorough. I just tried to remember the cutoff for the worst case scenario. So 20 or greater would be severe major depression. My study approach for this section always began with the NPE textbook, taking notes from this. The thing that really made the difference though for me learning this stuff was actually using the tests. Like if I had used it before, I had a much better idea of what it was actually measuring, how I might use it, how I might interpret the scores. That was the thing that made the difference. So I really tried to go out of my way to have a go at using the tests. When I was doing the WAIS and the WISC, I did use the manuals a lot to get a better idea of the test. And if for whatever reason I couldn't practically do the test, I would just do a lot of research into it. I would try and look things up on Google and watch videos on it and just try and get that practical sense of how it worked. So that's how I did all of the research for this exam. However, the thing that really made the difference with me consolidating my knowledge, making sure I really knew everything well, was spaced repetition through the form of flashcards. And I am old school, so I hand wrote them, which also helped me remember them more. I would just go through my flashcards. They were summaries of the information that I'd researched. I would go through them maybe 3 to 4 times a week in the few weeks leading up to the exam. Doing this really helped me personally for this section. Finally, one more thing to note from this section that I'm going to make a point of. In the NPE curriculum for the tests, when you cross-check it with the NPE textbook, you'll notice that they have taken out, just going to find it, they have taken out the Kaufman Adolescent and Adult Intelligence Test, or the CATE. It's no longer in the NPE most up-to-date curriculum as of 2024. And they've also added in tests that are not in the NPE exam textbook. So they've added in the Raven standard progressive matrices, they've added in the WHO DAS, the WHO QOL, and they've added in the structural child structured clinical interview for DSM, or the SCID. So I did some external research into these. I will leave some links to resources that I found helpful. Always go with the NPE curriculum first. These are just things that gave me an extra support in trying to learn how these tests worked as well. All right, now let's go through our first practice exam question. Just a reminder, I have made this up myself. You are doing a WAIS for someone who feels they have low cognitive abilities. They get an FSIQ score of 69 and their verbal comprehension is 95 and perceptual reasoning is 72. They scored lower for the other domains. What is the best conclusion to draw from these results? Is it A, the FSIQ score supports low cognitive abilities? B, their verbal comprehension suggests impaired functioning? C, their perceptual reasoning suggests impaired functioning? D, we cannot draw any conclusions from the results? Or E, the results reflect a diverse range of cognitive abilities. So what can we draw from this? What's the answer? Well, if we have a quick look, we can see A is a bit of a red herring. The question starts off by saying, this is someone who feels they have low cognitive abilities, kind of alluding to, is this something we should confirm? And that's what A suggests. It suggests that this does support low cognitive abilities. So even though they got a low score overall, we can see their verbal comprehension was a lot higher. Next, we can rule out B because we can see that verbal comprehension was actually, it seems to be their highest score. And we can also rule out C because C isn't the only indicator that perhaps they have impaired functioning. I'd also argue that it's not D because even though the results are varied, it doesn't mean that we can't draw any conclusions. If we go back to the question, we can see it's asking, what is the best conclusion to draw from these results? What is the best thing that we can assume from the information that we know? I would argue that it's E. The results reflect a diverse range of cognitive abilities. And we can see from this example that in order to answer it, I needed to know what the WAIS for was, and I also needed to understand the scores and what they meant as well in order to answer it effectively. So hopefully that just gives you a bit more scope or sense of what to look out for when you're trying to study for this exam. All right, moving on. Now let's talk about part 2 and 4 of the NPE curriculum. So that's knowledge and application of assessments and interview assessments. I'm just gonna pull up the curriculum. So if we have a little look, basically it's looking at various types of assessments, your knowledge and understanding of them, and then various types of interview assessments, your knowledge and application of them. So as always, pulled up my study planner, plugged in the different headings. I put them all together for the different forms of assessment and interview assessments. And I use the NPE textbook as my starting point for taking notes. To be honest, I didn't really use any other resources because I was quite familiar with these topics. So I literally just took dot points out of the textbook, summarized the information, and tried to have a good idea of what this meant. I wasn't so much memorizing, I just tried to have like a good idea of it. But let's go through an example. Let's look at something that's kind of tricky and broad. Suicide risk, self-harm, and harm to others. This one is tricky because we could think of it in the realm of ethical dilemmas and that kind of territory, and we might use some resources that we used in the ethics section. So when I was going over this, I did use the NPE textbook, but I also used Gamble and Boyle's Ethical Practice and Applied Psychology book, and they've actually got a whole section on risk. If I just quickly look this up, I'll show you. Clients who pose a risk to themselves or others, and they go through it. So I found that quite helpful too. And you'll notice that the APRA reading list also has a book on risk, assessment and management of suicidality. I did actually look that up when I was studying the exam. It was quite long and lengthy. I think I just generally looked through a little bit of it. But yeah, like those are examples of how you can pull out other resources and look into things a little bit more deeply if you need to kind of consolidate your knowledge. I was just working out, okay, if a client presented with risk, what would be the steps that I would need to take? What would I need to do to handle this situation if they were at risk, self-harm, risk to others? What would I need to practically do? That was what I was considering. Obviously, I think it's just worth pointing out, it's also good to know what you would do in accordance to your state or territory when handling risk. So let's go through another example question. This time we'll look at someone who's presenting with risk. So you work as a psychologist providing general counselling for TAFE students. You do an assessment of a young man who presents as high risk and says that he's been having suicidal thoughts. You say that you're concerned and think it's best if he visits his local hospital. He refuses, saying everything is okay and he doesn't want to be a burden. He says that he'll probably feel better if he just goes home. What is the most important next step for you to manage this client's risk? So A, you could insist on taking the client directly to the hospital. B, you could call his GP, talk about his current risk and confirm a plan. C, you could pause the session and discuss this with your supervisor who's a senior psychologist, agree on a plan together for how best to proceed. Or D, you could respect the client's wishes and let him go home. Well, it would be great if you could do number A, but the client has expressly said that he doesn't want to go to hospital, so I would rule that one out. We definitely wouldn't do D because the client presents at high risk. We could do B, we could call his GP and talk about his current risk and confirm a plan. That's definitely an option. But I would argue that the best is C, to pause the session and actually go and talk to your supervisor who's senior to you and work on a plan together. When dealing with things like risk, often the next best step to take is to talk about this with someone senior. Interestingly as well in this question, you can see that there were two answers I could have picked. They're not necessarily like right or wrong. That's where the exam is kind of tricky, and it can be really hard to know if you're doing well because often questions have a few answers that could be plausible or could be right. That's the thing that makes this exam tricky. So my hot tip would be to always look at exactly what the question is asking. Particularly at the end here, it was asking us, what is the most important next step for us to take? And it had an option to consult with someone senior than us to get some guidance and work out a plan. So I would argue C was the most appropriate one. All right, so finally, let's look at mental health disorders. If we consult the curriculum, we can see that it's asking us to know about DSM definitions, diagnostic criteria, essential features, understanding the limitations of diagnoses, and issues of differential diagnoses. And it has a list of disorders for us to look into. Something that I obsessed over a little bit in my mind, and this might just be me, was that when I was looking at this list, I wondered if I needed to know any disorders outside of this list. I wondered, do I just need to know these ones or should I look into other ones as well? And I think the thing that I took from looking at the curriculum was it does ask you to consider differential diagnoses. So I want you to just bear that in mind, and I'll talk about how I prepared for this section. So I made like a list in my NPE study planner of all the different disorders, and then I used the NPE textbook as a starting point for taking notes and just reading up about the disorder. But the book that I found really helpful, obviously the DSM-5 TR, like I did find it helpful to read that. The book that I really enjoyed was the DSM-5 Made Easy by James Morrison. The thing that I really liked about this book was that it helped me practically understand what a disorder would look like if I was seeing this client in person. It gave me kind of a really practical sense. And we have to take into account this book isn't based off the latest version of the DSM, but I still think it's a really useful resource, not just for the exam, but also in general in your work as a psychologist. I found this really helpful. So let's look at an example of how I was taking notes. If we pull up PTSD, you can see that I didn't just like copy and paste the DSM into my notes. I kind of tried to summarize it and keep it really broad because PTSD it's a long diagnosis. So I made note that it's exposure to a traumatic event and it's paired with the following symptoms. It lasts for 1 month after the event. There's some specifiers. And then one of the other things that I really tried to have a good idea of for that differential diagnosis part was taking into account other disorders that are similar to PTSD. So I knew PTSD is what we diagnose someone with 4 weeks after a traumatic event if they're presenting with the following symptoms. However, if they are presenting with the following symptoms straight after the traumatic event, we would diagnose them with acute stress disorder. So yeah, while there is a list of disorders to learn, I think it is really important to keep in mind any other disorders that could be similar to the ones on that list when you're considering things like the differential diagnosis. Now let's look at one more practice question. So you are meeting with a client for the first time. The receptionist warns you that he's been talking to himself in the waiting room. During the session, the client is very difficult to understand, and when you ask him a direct question, he changes the topic. A lot of the things he talks about doesn't make sense, and you find him hard to understand. He stares at you with an emotionless face and sits in a very rigid position. He says that he spends all of his time playing video games in his room and isn't interested in therapy. What is the most likely diagnosis for this person? A. Autism spectrum disorder, B. Symptoms of delusion, C. Schizophrenia, D. Antisocial personality disorder, E. Substance use disorder. Straight at the bat, we can cross off antisocial personality disorder because there's no symptoms here that relate to that. He's difficult to understand. He sounds like he's a little bit all over the place. Substance use disorder, possibly, but it's really not the best fit. Autism spectrum disorder, he mentioned that he sits in his room, he plays video games all day. That could be a really strong interest of his. He's not interested in therapy. Possibly, but it's not the best fit either. There's a bit of a herring in here, symptoms of delusion, because he doesn't seem like he's fully with it. Ultimately, I would argue that it's C. There's symptoms of psychosis. He's talking to himself. His thoughts seem scattered. He's presenting with negative affect. C best fits this person's schizophrenia. So that concludes our deep dive into the assessment section for the National Psychology exam. Hopefully after watching this, you have a better idea about how to take notes and fill in your study planner, and also how to research effectively strategies that you can use to help you get through. If you found this video helpful, don't forget to give it a like, leave a comment down below, or consider leaving a small donation. That would mean the world to me. I want to take a moment to just quickly plug the NPE study planner that I have developed, giving structure to your whole study process. So it gives a bit of a guide for what you could study when over 10 weeks, along with some reflective questions for each part of the exam to help amp up your study to that next level. So if you're interested in that, there's a link down below. Be sure to check it out. Maybe I'll see you around as well on my other platforms like Instagram or TikTok. But all the best with your NPE study prep. You've got this, you can do it. I'll see you in the next video. All right, bye.